All right, Chapter 5, which starts on page 98, we're going to talk about medical terminology. So, all medical terms are made up of Latin words to begin with, but they're compounds also, and compounds are made up of two or more words, such as smallpox. And then the other words that we'll talk about are how they're put together. We have roots, which something like therm, meaning heat, would be a root word, and the root portion of the word will combine with other forms, the prefix and suffix, for instance, and then form a complete word. So prefix you'll find at the beginning, and the suffixes are at the end. So here's some components. These are some examples. Tachy is a portion of a word that means fast. Cardia, meaning heart, and you can put that word together and say tachycardia, which is a fast heart rate. Here's another example. Hemo and thorax for hemothorax, which is blood in the chest cavity. Multiple words like this are put together in medical terminology. So here's another example, and most of them have a basis in Latin. So a lot of these words are coming from Latin terminology and then put together. So here's another one. Cardio, which is the heart, logi, which is the study of, and ist, one who specializes in. So cardiologist is actually a word that's put together that has specific meaning. The other thing that's used in EMS a lot is acronyms. These are abbreviations that are made up of initials that can be pronounced as a word, like CPAP. It stands for continuous positive airway pressure. Another one that's common is COPD, chronic obstructive pulmonary disease. You might have heard that one at some point. An abbreviation are used a lot, and these are letters or symbols used in place of words or phrases. So DNR would mean do not resuscitate. So when you use medical terms, you don't use it unless you're talking to other people that are similarly trained as you are. That way you're not causing any kind of confusion, but you definitely don't want to talk in medical terms to family members. And if there's any that you don't know, then don't try to use terms if you're not sure of what their meaning are. Just simply state it. Uh, you know, she has pain on her left side. But that's the easiest way. We don't want to cause confusion. So if you're worried that there's any potential for ambiguity, do not be reluctant to return to simple terms.
Because the general public is now more aware of the proper use of medical terms, first responders will be expected to use more medical terminology. Many medical and anatomical words use roots, stems, suffixes, and prefixes to form new words. Some examples are cardio for heart, gastro for stomach, and pulmono for lungs. Knowing what the roots, stems, suffixes, and prefixes mean will help you quickly decipher new words that you are unfamiliar with. Let's look at an example. The prefix peri means to surround. Once you have peri to indicate that the structure surrounds, add on the combining term for heart, cardio, and then the suffix eum to indicate a smaller portion of a larger system or structure. These elements form the medical term pericardium. Again, peri plus cardio plus eum equals pericardium, a sac that surrounds the heart. When medical personnel are speaking, it is difficult to stop, break apart, and decipher medical terms, but it will get easier with use. Practice will strengthen your abilities to understand and use correct medical terminology.
The practice of medicine today involves many areas of specialization. In your lifetime, you are likely to interact with physicians from a broad range of specialties. In 1933, the American Board of Medical Specialties, ABMS, was founded to establish standards for and monitoring of specialty practice areas. Pediatrics is the branch of medicine concerned with diseases of children. The physician is called a pediatrician. Within pediatrics, there are numerous subspecialties, such as pediatric neurology and pediatric oncology. Your family physician is concerned with the care of family members, regardless of age or sex. This branch of medicine is called family practice. Obstetrics is the branch of medicine concerned with treating women during pregnancy, childbirth, and the postpartum period. As a person changes and develops, they may need to seek out a variety of medical specialists, including an ophthalmologist for vision or eye care, or a cardiologist for heart disease, or one of many additional specialties. Later in life, people seek medical care from a gerontologist, a physician who is concerned with the aspects of aging. Surgery is defined as the branch of medicine dealing with manual and operative procedures for correction of deformities and defects, repair of injuries, and diagnosis and cure of certain diseases. Within surgery, there are numerous subspecialties, including orthopedic, trauma, and vascular surgery.
The language of anatomy and physiology. So, anatomy is the study of body structure, and physiology is the study of body function. And we're going to go over anatomic terms. The anatomic position is facing forward, hands at side, palms facing forward. So we need to know, we need to have a direction to refer to. It's a reference. So the reference position is standing up, facing forward, hands at sides, and the palms are facing forward. This divides the body into planes when you put imaginary lines down them. Once you're used to that, you have to familiarize yourself because the patient's left is what you would refer to as left. The patient's right is what you would refer to as right. Now, we divide the body into planes then, so that we can describe injuries or pain or anything like that to physicians when we give a description. The first line that we would imaginarily draw is called the midline. It's a line straight down the middle. It divides the body into right and left sides. Now, if you look at that line, anything that would be closer to that imaginary line is called medial. Anything that's more towards the side is called lateral, so it's farther from the midline. Bilateral would be termed on both sides, and unilateral would be one side. The next line that you would think about or draw an imaginary line through the body would be down the side, going down through the armpit. It divides the body into front and back portions. So the mid-axillary lines draws a line or divides the body into front and back. The front portion of the body we call anterior. The back portion is posterior. So if you have an injury on the back side of the leg, it'd be posterior. Superior is the top part of the body, and inferior is the lower part of the body. If you were to divide a line going through the belly button, to divide it into top and bottom portions. And when you refer to extremities, anything that is closer to the torso is proximal. Anything on an extremity that's farther from the torso is distal. Palmar refers to the palm of the hand, and plantar refers to the sole of the foot. That's how you plant your foot. Okay, so these directional terms are important. It's also important to know your body regions. And so, of course, you've got the head, which is the cranium and the face, and then you have the torso, which is the chest or main portion of your body, and then you have extremities, upper and lower. And here's a picture of the midline that divides the body into right and left. You also have proximal and distal. Proximal is anything closer to the torso. Distal is anything farther from the torso. You also have on either side of the midline an imaginary line that would go down on either side, dividing the body further. Like the right half would be divided again into halves. Those on each side would be called midclavicular line. Medial is anything closer to the midline. Lateral is farther from the midline. And then the mid-axillary line divides the body into front and back, front being anterior or ventral, and the back being posterior or dorsal. Dorsal and ventral are kind of used in reference of in front of, like the trachea is in front of the esophagus, so the trachea would be ventral to the esophagus. And then top and bottom is superior and inferior. The midclavicular line divides the chest into regions. Since there's two clavicles, there are two midclavicular lines. So here's how the planes work. You've got the sagittal plane, which is like the midline. And then you have the transverse plane, which divides the body into top and bottom. And then you have the frontal or coronal plane, dividing it into back and front. Abdominal quadrants. The abdomen is divided into four quadrants, and each quadrant is labeled right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. That gives you an idea of what types of organs might be injured depending on what quadrant the organ lies in. And here's an example of how the abdomen is divided into quadrants. And if you look, the liver is a big, large organ in that right upper quadrant. So any injury to there could cause a liver laceration, maybe some severe bleeding, pain in your stomach that maybe is bloating or gaseous. You see where the gallbladder lies. Sometimes you see people with big kind of firm bellies from maybe a disease process if they've got liver disease, or even pancreas sometimes up in that left upper. Kind of more centered though, more medial. Positional terms. Sometimes you will find people lying supine. That's a patient that's lying on their back face up. You may find a patient lying prone, and that's less frequent. Usually people don't lie prone unless they're unconscious or been hurt. But the patient lying on their front, face down. The recovery position is patient lying on their side, either right or left, and it is preferred for any unconscious non-trauma patient because that way they don't vomit and aspirate. So here's somebody laying supine, and here's somebody laying prone. And here's somebody in the lateral recumbent or the recovery position. And this person is actually lying on the right lateral recumbent. Sorry, on the left lateral recumbent. She's laying on her left side. And you see how I mean that you have to be careful and use the patient's right and left and not your own right and left. This is the semi-Fowler position, which is sitting at about a 45-degree angle. High Fowler's is a 90-degree. So Fowler is the patient seated upright. Semi-Fowler is leaning back in a semi-sitting position. Chapter review. Medicine has a language of its own. As an EMT, you will frequently communicate with medical professionals who speak this language. Medical terms generally consist of a root with a prefix and or suffix. I would suggest that you also look at the list of terms on page 100 and try to become familiar with them. Actually make yourself some flashcards for them. Medical terminology is the language of healthcare. Roots, prefixes, and suffixes can lend clues to the meaning of many terms, and sometimes that gives you an idea without even knowing the word before you can figure out the general meaning. Understanding anatomy and physiology is like reviewing the owner's manual for the body. And anatomical terminology brings precision and accuracy to descriptions. Is my use of medical terms accurate and descriptive? Think about that. Is this, if somebody else were listening to the way I described a patient care, would they understand? Would they get a good visual of what actually was going on and what happened? Can I identify critical organs and structures that reside in an area where a patient has a complaint or traumatic injury? It'll give you very good clues what's going on with the patient if you can understand what organ it's affecting. You respond to a teenage boy who has taken a hard fall from his dirt bike. He has a deep gash in the outside of his left arm, halfway between shoulder and elbow, and another on the inside of his right arm, just above the wrist. His left leg is bent at a funny angle, about halfway between the hip and knee. So how would you describe that? Okay, a deep gash on the outside of his left arm, halfway between the shoulder and elbow. So it's on his lateral arm, lateral upper arm, which is the humerus, and he's also got one inside of his right arm just above the wrist. So he's got a medial injury too, just above the wrist. His left leg is bent at a funny angle, about halfway between the hip and the knee. So he's got deformity to his femur bone is an accurate way to describe that. When you cut away his pants leg, you see a bone sticking out of a wound on the front side. How would you describe your patient's injury over the radio to the hospital staff? Well, he's got a femur, obviously, if it's the upper leg that they're describing, and he's got an anterior bone sticking out. So he's got the femur is sticking out anteriorly on his whatever right or left leg.